Hello, welcome to this video. My name is Tyler and today we're going to be learning about the NHS UDA system. So this is a really important system within the NHS in dentistry, and it's vital you know at least a bit about it for your dental school applications. Now all the information provided in this video is from 2025, okay, so things do change quite quickly in dentistry. It does change every April when it comes to the banding prices that we're going to be talking about, but yeah, this is from 2025. So for this video, my aim is that you're going to understand three things. Okay, so the first thing would be to understand what a UDA is. Then the second is to understand the treatment completed under UDAs. And then the third thing is to know why this system causes frustration. So why this system can cause frustration for dental professionals, but also the public, and how it has a knock-on effect. So what actually are UDAs? The term UDA stands for Units of Dental Activity. Okay, Units of Dental Activity. This is used under the NHS, and so dentists with an NHS contract will be measured in how much work they do using UDAs. Each treatment a dentist does will be a certain amount of UDAs. Depending on the area and the practice the dentist works in, they will have a UDA target which they have to reach per year. Now, a bit of background information. The UDA system was set up by the NHS in the year 2006, so it's quite an old system, I would say. It's been about 20 years and not much has changed really within this system. And the aim is that it will make NHS dentistry more desirable, as dentists will be encouraged to meet UDA targets and so would effectively work harder at reaching them. They thought it would give them more motivation because they have to reach certain targets. A lot of dentists would say otherwise, but here we are. Dentists are paid per UDA they make. Okay, so for example, the average UDA value in London is £13. So for example, if a dentist is basically making one UDA, they are paid £13 for that UDA. Or two UDAs, they'll be paid £26 and so on. Now let's have a look at the NHS dental treatment bands. So when you are seen under the NHS by the dentist and you are coming in for an appointment, whether that's just a checkup or whether that's treatment you might need, you will be paying a band. Okay, so there's three bands. As you can see here, we have a poster, and this poster contains all the information about the bands of treatment. Now, it's compulsory that in a dental practice they do have these posters around for patients to be able to see, and so there's honesty about how much they have to pay. So yes, the practice has to be transparent about how much the patients may have to pay regarding certain treatments. So as you can see here, there's certain costs to different bands. So we've got band 1, which is £27.40, band 2 at £75.30, and band 3 at £326.70. Now these do change in price every single April, but this is as of the 1st of April 2025. Now let's look at what's included within band 1 treatment. Okay, so when you're paying £27.40, this is all the stuff that the dentist can do if obviously necessary. So this includes a checkup, which also is called an exam or an examination, but yeah, usually it's known as a checkup. It contains x-rays, so any x-rays needed, so not just x-rays where they put the film in your mouth, also known as intraoral x-rays, but also extraoral, so where they maybe want to do a larger x-ray, a larger radiograph, so basically that will be called an OPG. That's not necessary to talk about at the moment. Any diagnoses they need to make, so if you need to be diagnosed with anything, that obviously is under band 1 as well. You don't obviously have to pay any extra for that. Any dental advice, so if they need to be able to teach you about how to floss or how to brush, or you're asking lots of questions about certain dental treatments, that will be under band 1 as well. A scale and polish only if necessary, so not all the time a dentist will deliver a scale and polish, which is basically a clean in checkups, but they can do sometimes if it's necessary. Fluoride application, so applying fluoride to the surfaces of the teeth, that's also included within band 1. Fissure sealants, so basically they're kind of like fill-ins, but there's not any drilling. It's just basically to fill in the fissures to decrease the risks of decay, and it's usually done on children. And also emergency treatment, so if a patient comes in for an emergency appointment, say for example they have a toothache, it will still be under band 1. even if they need any treatment for that toothache, for example, even an extraction. Now, as all of these come under band 1, they will cost £27.40 from 2025. Okay, so again, it does change every April, but this is the most up-to-date price. Okay, now it doesn't matter how many x-rays you need, how much diagnoses you have, how much advice they give you, or how much treatment they do in that emergency. It still is £27.40, okay, no matter how much band 1 treatment you have in one treatment plan. Now, a very important thing to be aware of is that fissure sealants are actually moving on to band 2 from 2026 in April, but at the moment they technically are still in band 1, so I've just made a little note to basically say that they are going into band 2, but at the moment they are still within band 1 treatment. Okay, so next, band 2 treatment. So there's a bit less in band 2. So it includes fillings, it includes root canal treatment, also known as RCTs. It includes extraction, so taking the teeth out, and it also includes periodontal cleaning. Now, a lot of people don't know what periodontal cleaning is, which is fine, obviously, but it's basically a deeper clean than a scale and polish, and it's aimed at patients with gum disease. So the charge for band 2 treatment is, as of April 2025, £75.30. Now, again, it doesn't matter how much treatment this patient needs, it will still be £75.30. So, for example, the patient might need 2 fillings, 1 extraction, and 1 root canal treatment for 1 tooth. It will still be £75.30 for that patient. Now, band 3 treatment includes crowns, bridges, dentures, and mouth guards. Band 3 treatment's mainly concerned about prosthetic dentistry. So this is dentistry that basically is aimed at replacing missing teeth. Obviously, mouth guards don't replace missing teeth. They help with things like grinding. So when we think of grinding, it's also called bruxism. That's definitely a word that you should hopefully be able to research about and know for your dental school interviews. It will very impress them. You don't need to know, but it will impress admissions if you can remember that word. But yeah, band 3 treatment, it mainly is concerned about replacing missing teeth. And for band 3 treatment, the price as of April 2025 is £326.70. And again, it doesn't matter if the patient needs 2 crowns and 1 bridge or just 1 crown. They still pay that £326.70 only once for that course of treatment. Now, how about when a patient needs more than 1 treatment, but these treatments are within different bands? So some patients may need more than 1 treatment. So let's look at this patient, for example. Let's call him Bob. Now, Bob needs a fill-in on upper right 8 and lower left 1. He needs an extraction of lower left 8 and lower right 8. And he also needs a scale and polish. Now, first, let's look at what bands these all fall into. So the fillings will fall under band 2. The extraction will also fall under band 2. But the scale and polish will fall under band 1. So what will Bob pay? Now, Bob has to pay the charge of the highest band of treatment provided. So he'll have to pay the band 2 charge. So he'll have to pay £75.30 overall. Now, regardless of how many teeth need treating, it will just be £75.30. Now, patients always pay the cost for their treatment once only, even if the treatment plan takes multiple appointments and is treating multiple teeth. Even if the treatment involves different charge bands, the patient just pays the price of the highest charge band. So we've talked about the bands, so what the patients pay. Now, how are the dentists paid? So each dental treatment band is associated with different UDA values, up to a value of 12 UDAs. So let's look at band 1 UDAs first. So under band 1, a dentist can either get 1 UDA or 1.2 UDAs, okay? So 1 UDA is basically for checkups, x-rays, any diagnoses, dental advice, scale and polishes, fluoride application, and fissure sealants. They get a bit extra, so 1.2 UDAs, if they do emergency treatment, okay? So emergency treatment is 1.2 UDAs, so a bit more. Now, if we look at our example from earlier, where we say about London dentists with an average of £13 per UDA, they'd get paid £13 for all the stuff that's worth 1 UDA, and £15.60 for emergency treatment. So that would be 1.2 UDAs. Now let's look at the band 2 UDA. So with band 2, it could be split up into 3 types of UDAs that the dentist can get. So they can either get 3 UDAs, 5 UDAs, or 7 UDAs. So for them to get 3 UDAs, that's basically including all fill-ins, all extractions, root canal treatments but only on incisors and premolars, and periodontal treatment, so that deep cleaning for gum disease. Now for 5 UDAs, so a bit more money, that will include root canal treatment on molars. It's only because molars, they have more roots, so it normally takes longer time and it's more difficult. So it kind of reimburses them for their time and effort. Now 7 UDAs is for root canal treatment, but for multiple teeth, okay? So it might be where a patient needs root canal treatment on 2 incisors, and that will be worth 7 UDAs. Now for band 3 UDAs, it's quite an easy one to remember. It's always 12 UDAs, so no matter if it's a crown, bridge, denture or mouth guard, no matter if the patient needs 2 crowns, 3 crowns, 2 bridges, 2 dentures, it will always be 12 UDAs for each course of treatment opened by the dentist. Now it's very important to know that some patients are exempt from costs, which means they don't have to pay. So some patients are not required to pay for their treatment, and so it is free under the NHS. Now some examples, not all of them, but some examples of people that will be exempt from NHS prices are people under 18, or people under 19 in full-time education, people who receive universal credit, so a lot of benefits make people exempt, people that receive pension credit, women who are pregnant, or women who have had a baby in the last 12 months. Now again, it's a very common misconception, so I'm just going to mention it. Even though the patient doesn't pay, the dentist is still paid their usual UDA amount. Now, why don't a lot of people like the UDA system? Practices have UDA targets set by the NHS, which they must aim to reach each year. For example, let's say that a practice must hit 40,000 UDAs in 1 year. Now, what's not great about this system is that if the target is exceeded, so for example, the practice does 41,000 UDAs in the year, usually they're not paid for those extra UDAs that have been accomplished, which is obviously not worth it. But then if the target is not met, so for example, they only reach 35,000 UDAs in the year, they might actually receive a penalty. So they might actually have to pay back money to the NHS. Sort of like a fine, really, so they actually lose money. So even if a patient comes in with a complex treatment plan needed, so like Bob, for example, needed multiple treatments, the dentist will still only be paid the highest UDA of the treatment. So if we look at Bob's treatment plan, the fill-ins will be 3 UDAs, the extractions will be 3 UDAs, and the scale and polish would equal 1 UDA. So the dentist will actually receive the highest UDA value, so the dentist will receive 3 UDAs, and so only 3 UDAs reaches the practice's UDA goal. Now, to reach these such high UDA targets under the NHS, dentists usually have short appointments so that they can see as many patients as possible each day to make as many UDAs as they can. Now, obviously, this can affect both the staff at the practice, so the actual dentist, but also the nurses and the staff around them, for example, the admin team, like the receptionists, and also can affect the patients. Dentists usually end up feeling burnt out and tired, with patients feeling like they've not had time to properly build a relationship with the dentist because of these such short appointment times. Now, many dentists and dental associations, such as the BDA, so British Dental Association, which is definitely something you should research about, are raising their concerns and advocating for reforms in this system. So reform just means a change. Although there is still changes to be made, there are some changes coming to 2026 in April. Now, obviously this is great. There's some changes happening. I will make a separate video on all these changes, but some dentists do feel like still there's not enough change, but it's definitely going in the right direction. So there's definitely progress being made. Now that's it for the content of this video. So why should you understand this? So first of all, it shows the admissions team you know about the NHS system and how it works in dentistry. It then can show that you can recognise the negative sides to working in NHS dentistry. You are then able to draw conclusions on your own opinion on the NHS UDA contracts. You can make informed opinions on how the UDA system can be reformed, and it shows that you have taken time to research also who is exempt under the NHS. So that's it for this video. I really hope you found it useful, and I hope it helps you with your applications to dental school. If you did find it useful, please consider subscribing or hitting the like button, because it will really help, and even comment if you have any more questions to do with the NHS UDA system. And hopefully I'll see you in another video.